Well, good evening, everybody who's shown up. We just let you in from the room, the waiting room. And welcome to Practice Best Practices workshop. I'm Den Santoro. I'm going to give a brief introduction, and then I will be turning people over to to our panel, who will then make a presentation and try and answer all your questions. So hang on a second.
Anyone who does not love the
Say what? Okay, let me share my screen here. Okay. So welcome. Good to have everyone here. And of course, my screen went into another mode. All right. This is Practice Best Practices, Accessing Affordable Healthcare for Creatives. It's a workshop that we hope will provide a lot of information for those of you who show up and those who see it afterwards in video. I want to start by telling you I'm Den Santoro. I'm the program manager for Practice Best Practice and coordinate all the workshops. And we'd like to start off by thanking our funders, Rockland Charitable Trust Foundation, then the Dartmouth Fall River, Marion, Mattapoisett, New Bedford, and Rochester local cultural councils, which are local agencies, which are supported by the Mass Cultural Council, and the MCC itself, which is a state agency. We're also supported by generous contributions in kind and from some of our partners, New Bedford Art Museum Artworks, New Bedford Co-Creative Center, New Bedford Creative, and SNG Project Gallery and Brokerage. And we want to thank Carla Abreu-Pavao and Thalia Mercedes for taking the time to put together the materials for this workshop and for answering your questions as we begin. So a few notes before we begin. Just a few ground rules to help make the whole workshops flow smoother. If you have questions, please type them into the chat. We'll be monitoring it. Or later on after the presentation, feel free to raise your hand and we'll call on you. When we select your question, we'd like to have you unmute the, whoops, one second. Sorry, I just lost track here of something. All right. So when we select your question, we'll ask you to unmute so you can ask it and be recorded. This will also give you the ability to ask some follow-up questions. And if you prefer us to read your questions rather than go on screen, type that in when you type in your question. We'll have plenty of time for questions and follow-ups. Please, because we are recording, please make sure you don't give too much personal information. We don't want people getting too much detail about you for a number of privacy reasons, but ask what you need to so that you can get your questions answered. During the presentation, please keep yourself on mute so that we don't have talk. Yes, please. Okay, thank you. And you can unmute when you're asking questions. We suggest that you put your Zoom in speaker mode rather than gallery mode during the presentation. You'll have a better view of the slide deck and the person talking. Closed captioning is available. You can turn the closed captioning on so you can see it with a little CC down at the bottom of your screen. You can see me pointing to a screenshot of that on my machine here. But that CC down at the bottom can turn on closed captioning so you can read along if you're having any trouble understanding things. Okay. And towards the end, we will put out a short survey. The survey is anonymous. But it helps us improve our workshops, and it helps us with our funders to raise money so we can continue to bring these workshops to you. Come on. There we go. Also, feel free at any time to email us with comments or add them to the chat, or put them up on YouTube or Facebook. And you can always contact us through our website or through our social media channels. We like feedback, so let us know what you have to say. We also will have the slide deck that Thalia is going to be presenting available for you to download from our website after the workshop. So it is also full of useful links that you may find helpful in accessing resources. She'll tell you more about that. You can also find all of our workshops, past and present, at practicebestpractice.com, workshops.html. So feel free to see any of our past workshops. We've got a lot of good stuff up there. We are recording this workshop and it'll be online in a few days. So that's important to know. And if you find it helpful, spread it around to other people as well. And we hope you've liked us and followed us on Facebook and Instagram, or signed up for our email list, all of which are connected to our website. So feel free to go to our website and do that. And our workshops are always free, but they do cost us to produce. So anybody who can make a donation, we're always willing to accept a tax-free donation, which you can do from our website. There's a donate button at the top of every page on our website, and it's tax deductible. So hit that donate button, and $1, $5, whatever you can afford. Our panel tonight we have Carla Abreu-Pavao. Carla has had over 17 years of community work, and she has worked as medical assistant. She's worked as a benefits coordinator. And she has done much work with the Health Connector in this area. She will be answering many of your questions tonight. We also have Thalia Mercedes. Thalia works with and communications and outreach at the Massachusetts Health Connector, where she focuses on community engagement. You all can read the more full versions of their bios at our website through the information for this workshop. So we suggest you read those full bios to know more about them. And without further ado, I am going to turn things over to Thalia, who's going to start with her presentation and inform you of some of the things you need to know to do this work.
Thank you. Just want to make sure that everyone can see my screen.
Looking good.
Okay, great. All right. So my name is Thalia, and I'm here today with the Health Connector to go over some of the health insurance options for individuals and families. And Carla is with me here today. She is a community specialist and my colleague, and she'll be here to answer the majority of your questions at the end. Or you can also, like I said before, just put them in the chat and then we'll be going through them at the end. Okay. So in our presentation today, we're going to go over what the Health Connector is, how to apply for the health and dental insurance, what's new in coverage for 2024 and 2025, and how to save on your monthly premiums, and how you can get help applying for coverage or filling out that application if needed. So what is the Health Connector? So just a quick overview for those of you who are not familiar with the Health Connector. We are the state's health insurance marketplace for individuals, families, and small businesses, and we provide access to affordable health insurance. Those who shop for coverage with the Health Connector are usually those who can't get insurance through their job, their spouse's job, or if you have a part-time job like Uber or Lyft or something along those lines that just does not provide health insurance to their employees. And the focus of our presentation today will be health insurance for individuals and families, but I did want to mention that we also have dental insurance that you can buy separately, and we also provide health insurance for small businesses with 50 employees or less. So when you shop through the Health Connector, you can be assured that all plans meet state and federal standards of coverage. When applying for insurance through the Health Connector, you'll choose from a variety of plans based on the area where you live. And because the Health Connector is the state's marketplace, we have benefits and programs that can help to reduce your monthly premiums. And just for clarification, when I say premiums, it's just your monthly payment. So we have advanced premium tax credits, which I'll go over in more detail in a later slide. And we also have our connector care plans that are unique to Massachusetts, and it's based on individual and families' incomes. So those who are eligible for a connector care plan may now qualify for low or no cost health insurance. And again, we'll talk about that a little bit more in the presentation. So we are currently in what we call our closed enrollment period, which runs from January 24th to October 31st, which means that to enroll in a plan with the Health Connector, you must have a qualifying life event that will open a special enrollment period for you. But the good news is that we also have an open enrollment period that's coming up very soon on November 1st. So like I said before, you have to have a qualifying life event that opens up a special enrollment period. And what a special enrollment period is some change in your life that will make it so that you are able to enroll in a plan. So qualifying life events that open up a special enrollment period for individuals and families could be anything from getting married, having a baby, a change in your income, a change in immigration status, losing your job, or losing your job that previously had you had health insurance with. And it's important to note that your qualifying life event should be reported within 30 days, and individuals have 60 days to select a new healthcare plan. Okay, so how do you apply for health and dental insurance with the Health Connector? So here we have our homepage where you can use one application to apply for health coverage through the Health Connector or MassHealth, because we are two separate entities. The application is available in Spanish and in Portuguese, as well as if that is your preferred language. So when I say one application, what I mean is that you do not have to know which you are applying for, whether it is MassHealth or the Health Connector. You enter your personal information into the application, and the application will determine which one you are eligible for in that moment, right in that moment. So there are a few qualifications you must meet in order to be qualified for insurance through the Health Connector. So you must live in Massachusetts. You must be a U.S. citizen or be lawfully present in the U.S. You cannot have or be offered health insurance through your employer. And you cannot have public health coverage like MassHealth or Medicare. And when you are applying for coverage, you'll need the following information. Just have these things available to you while you're filling out your application. So your social security number for everyone who is applying, including your children or spouses, if you are applying for them, your immigration documents, if that applies, any income information, including copies of your pay stub, net income for those who are self-employed, and monetary determination if you are someone who is receiving unemployment. And if you don't have all this information at the time that you are filling out the application, that's all right. Just provide us with the information that you do have, and then the Health Connector or MassHealth will follow up with you and request more information if needed. So here is a list of things that should be reported as income. We get this question a lot, so I just wanted to put this on the screen and I'll leave it there for a while. So one of the questions that we get a lot is, what should I consider income? Because the income does determine whether you are eligible for MassHealth or the Health Connector, and it also does decide how much subsidies, if any subsidies, you will receive. So people have a lot of questions about this. Okay, and additionally, just a little bit more on this slide, it's important to keep your income and application up to date to make sure that you get the right amount of help paying for coverage and lower the risk of owing money to the IRS at the end of the year when you are filing your taxes. So you can log in at any time and update your income information, not just at the time of completing your application. So I know with a lot of Uber and Lyft drivers, your income does fluctuate month to month, and that could affect your health insurance and how much you are paying for your health insurance. So just know that you can go into your application at any time and update that information. Okay, so let's talk about the Health Connector coverage in 2025. So in 2024, the Health Connector expanded eligibility for the Connector Care plans as part of a pilot program. And the Connector Care program, which combines federal and state subsidies, will now provide lower premiums, co-pays, and no deductibles to more Massachusetts residents in 2024 and 2025. And even if you aren't eligible, sorry, did that switch over? Yep, sorry. Even if you aren't eligible for a Connector Care plan, you can still qualify for advanced premium tax credits, and this will also help you to lower your premiums with any Health Connector plan. Okay. So as previously mentioned, whether you are eligible for tax credits or a Connector Care plan, you have a chance to save on your monthly premiums. So with the advanced premium tax credits, the IRS will send the credits directly to the insurance company, so you'll pay less for your insurance each month, and you can always decide how much of those tax credits you choose to apply towards your monthly premium. So if you know that your income fluctuates, that might be a good choice for you. With the Connector Care program, your monthly premiums are lowered using both federal and state funds if you are eligible for this program. These plans have low monthly premiums, low out-of-pocket costs, and no deductibles. So when you qualify for a plan with the Connector Care program, you will be able to select a plan type, which is based on your income and family size, and this will determine how much you pay for your monthly premiums. So you can pay anywhere between $0 and $264 per month when you are in one of the Connector Care plans. So also new for 2024, I mentioned that the Connector Care program was expanded as part of a pilot. This expansion also included offering more plans in this Connector Care program. So all the healthcare carriers or health insurance companies who offer plans with the Health Connector will now also provide plans in the Connector Care program as well. And that took effect on January 1st, 2024. So that is available now, and it'll continue to be available through 2025. So what does this mean for Massachusetts residents? So very generally speaking, that means that in 2024 and in 2025, individuals and families with higher incomes will now be eligible for the Connector Care plans. So for example, in the past, an individual person who has been, the income limit for an individual has been increased from $43,470 to $72,900 for 2024. And now a family of four, that limit has been increased from $90K to $150K. So as I previously mentioned, if you qualify for a Connector Care plan, you will need to select, you will be put into a plan type that is based on your income. The dollar amount that you're seeing on this screen will determine how much the minimum payment would be for that plan. So for example, the lowest cost plan in plan type 2A could be as low as $0, while the lowest cost plan, if you are put into a 3B plan, would be $147. Now, this is not to say that this is like the only option in these plan types, because that is just the lowest cost plan in that category. So you can choose to have a higher plan that might have a bigger network. So I want to quickly go over some tools that we have available on our website to help compare your options for health insurance plans and how to save. So some of the factors that you should consider when shopping for health insurance, there are premiums, which is the amount you pay monthly for your health insurance. There are covered benefits, which are the services that the health insurance companies agree to pay for when you enroll in their health plan. And depending on the service and the carrier, you might be responsible for paying a portion of that service. That portion that you're responsible for paying will be your out-of-pocket cost. And lastly is the network that someone chooses to enroll with, which includes your doctors, your specialists, and the hospitals where you get your services. And this will vary depending on the carrier that you select and also that plan type that we talked about in the previous slide. Okay. So to help new and returning Health Connector members, we have a few great tools that will help you compare and select a health insurance plan. So our most notable tools are our Get an Estimate tool and our Plan Comparison tool that are available to everyone outside of their individual applications, meaning that you don't have to sign in to your actual application to have access to them. So these tools allow you to see what plans are available in your area where you live and give you an estimate of what your savings might be. And I say might because it isn't accurate because it does not have all your personal information yet. These are the tools that can be used outside of your application. And then we have the Plan Comparison tool, which helps you find providers and facilities covered by the specific plans. The Plan Finder tool works very similar to the Get an Estimate tool and the Plan Comparison tool, but it is more precise since it is based off the information that you have provided in your individual application once you have logged into your account. So once you've used all of these tools and you've done your research, I just want to remind you that enrollment is not complete until you make that first premium payment. So you can go through the whole application, compare plans, select a plan and everything, but until you make that first premium payment, you're insured, nothing is finalized basically. So if you choose to enroll in the Health Connector plan, you must make your premium payment by the 23rd of the month before in order to get coverage that starts on the 1st of the following month. So for example, if you are someone who wants coverage starting on October 1st of this year, you would need to shop, select a plan, and make that first premium payment by the 23rd of this month. By September 23rd, you would have to make that payment in order to be covered on October 1st. And this is just an example of what your monthly bill will look like. It'll break down your monthly premium, show the advanced premium tax credits. You can apply if you are eligible for that. If you are eligible for Connector Care Plan, it will also be on there as well. And I just want to mention that monthly premium payments can be made one of three ways: online through the payment center. You would have to use a checking or savings account since we do not accept credit cards, and you can also pay by mail or over the phone. So I know I threw a lot of information at you guys, so I just want to provide you with some resources that you are accessible in person and more one-on-one. So if you need assistance with the application process, we have resources available to Massachusetts residents free of cost. You can receive help with your application through customer service or one of our community partner organizations. Our customer service is probably the best way to reach us and the fastest way, and that number is 1-877-623-6765. And we also have on our website a list of community events happening around the Massachusetts area where you could find in-person help as well. Okay. So we also have our community partners. Oops, sorry. So we also have our community partners, which are the certified application counselors, as well as our navigators. Our navigators and our CACs speak multiple languages, and they speak the languages of the people in their communities, and they are really the experts in all things the application. So you can call them and make an appointment. You can go into any of the walk-in community health centers where they're located and make an appointment that way as well. And I also just want to point out, if you don't know where the closest person is, you can also go onto our website, and there is a tool on there that you can put in your zip code, and it'll tell you where the nearest CAC or navigator organization is. And I think that is the end of our presentation. So if you have questions, now would be the time to ask them.
Great, thank you, Thalia. That was great. Why don't you unshare your screen? And we do have one question, which actually looks a little complicated in the web. Shakira Gonzalez, you want to unmute yourself and ask your question?
Hi, I just had a question because so years ago I had health insurance through my job, and at one point I think my medical got so out of control that I got like a secondary insurance through, like, I don't know if it was MassHealth or a Connecta plan of some sort. And I'm kind of running into the same issue today with my treatment, where I have health insurance, but my medications and my weekly treatments are more than my rent per month, which is crazy. So I didn't know if there was like a way that somebody could get secondary insurance through one of these programs or services. And if so, like, what are those guidelines? Like, you have to meet like a certain like benchmark when it comes to like the amount owed. Like, I just paid like $10,000 out of pocket for a surgery.
Now, are you paying these out of pockets because it's part of your deductible?
My
Are you talking
deductible,
about plans with deductibles?
so my deductible is like $2,000. I'm way past that. Just the medication. So I'll give you an example. I go for infusions once a week for 2 hours. Just to walk in the building is like $45. The medication that they administer there is like another $65 on top of the monthly medications that go along with it. And that's just for like one of the ailments. So like you add those weekly expenses on top of like inhaler, $75, the EpiPens, the insulin, like all those things.
Right.
And I pay co-pays for every single thing. And that one appointment that I have, again, for like my infusion, to walk in the office, you're paying the doctors a copay, and then you have to go across the room to the lab. So you pay a copay at the lab, and then you leave the lab to go to another floor, and then you pay a copay at the infusion center, because technically it's 3 separate appointments.
Right. So, I mean, everything through the Health Connector or even applying for MassHealth as a secondary, it's going to be income based. So, I mean, you could always apply with your information, your income information. Now, having already insurance through work, and applying for the Health Connector, you're only going to qualify if your work insurance, if the cost of the work insurance is 9.12% of your income, and if that's the lowest cost plan with the Health Connector. So that's the only time you would qualify for a Health Connector. So if you feel like the plan at work is over 9.12% of your household income, then I would say yes, go ahead and apply for the Health Connector, because you might have a better option, like with a Connected Care plan. Those plans don't have deductibles. they have the lowest cost premiums and the lowest co-pays. So that's what you would have to do, but you could always apply, see someone, bring in your information, they'll do the application. The application is already programmed in a way that once we input your work insurance information, it will determine if yes or no you qualify for anything with the Health Connector or MassHealth.
Okay. Yeah, I don't know if it's above that percentage.
Are you
I know it
from Fall River?
No, I'm from New Bedford, but I
New
work for the
Bedford.
state.
Okay. So, and do you have children or is it just you?
So I have a child that, well, it's not biologically mine, so I'm considered their permanent guardian for the time being.
Yep. So if you want to, I'm actually in New Bedford every other Tuesday. I'm at the Mass Hire in New Bedford.
Mm-hmm.
And I'm there from like 11 to 4. So you could always come in with your information. You can ask for me, Carla, and we can sit down and go over your information and see if there's any options for you.
Okay. Thank you.
You're welcome.
Do we have other questions out there? I don't see any typed in through the chat, but you're also welcome to raise your hands or just unmute yourself and ask.
Are there places in the greater Boston area to get help with the application?
Yep, and like Talia had mentioned on our slide, if there is a tool on our website that if you put in your zip code, you will get a list of all the Navigator sites. Also, if you have a community health center in your area, usually those will have certified application counselors and even navigators if they're a Navigator organization where you can get help in person.
Thank you.
I'm gonna
And
put, I'm gonna put that link into the chat so people can easily just pick that one up because that's a useful page for people to have.
Yep, so I just sent it in the chat now.
Oh, okay, great.
So you guys can just go directly on there and find somebody near you.
Yeah, it's helpful because it lets you just put in zip code information and stuff and find places where you can walk in or call that are close to you. We have other questions? I'm surprised with all of that information that there aren't more people saying, let me ask a question.
Or if you need anything clarified to anything you didn't understand during the presentation.
One thing I want to ask, because it's come up before in some of my conversations, for people who are in the gig economy, some people are able to do it so that they just file their taxes once a year, and that's used as their income level. And other people, because they do it year to year and it's the same, not necessarily the same income, but the same various sources of gig economy. Other people have told me they need to do things like every month they need to file a new number for how much they earned last month. Can you elucidate that a little bit more?
So they're filing every month their taxes?
No, they're filing with the Mass Connector that this is what they earned
Okay,
last
so
month.
you're talking about the update of the income.
Yeah,
Yeah, because so usually when you're like self-employed, it is a lot different than when you're employed and you're getting paid and get your W-2 at the end of the year. So on self-employed, we look at the net income versus if you are working with a W-2, we're looking at your gross income. So self-employed, we look for the taxes, usually your last year's taxes. We'll look at your Schedule C, how much was your net, and if you are paying any any self-employment tax. If someone doesn't file I mean, you're not going to file your income tax every month. What you can do is you can create what we call a profit and loss. So basically, create a spreadsheet where you break it down monthly, what your gross was minus your deductions, give you net, and maybe every 3 months or every 6 months, come and update your information with us, especially if you see a significant change on your income monthly to month. So that's what I usually advise my clients to do, is keep a profit and loss. You don't have to see an accountant for that. It's something you can keep yourself. And maybe every 3 months or 6 months, you look at it and you say, wow, I'm getting close to that mark that I'm supposed to be at. Let me go see someone to update the income.
And what happens if they just use their annual taxes, and when they file this year's taxes at the end of this year, they go over that limit?
Again, you just got to keep an eye on it. You don't want to go over that limit. So if you feel like you're getting close to the end of the year and you already are at the limit, I would advise you to go in and speak with someone or even update your income online, so you don't have to pay back the tax credits that you are receiving, the extra on the tax credits.
Okay. Other questions out there? I'm amazed. Carla and Thalia, any things you want to throw out there to the that you didn't cover, or you think that you should cover in more detail for folks?
I think that we covered pretty much. Again, everybody just needs to understand that it is income based. Everybody's income is different, so everybody will get like an individual answer to an application. I would say if you're looking for help in person, look to your community health centers, look to your hospitals. Some hospitals have departments in them that also have navigators or CACs, and that's the best way to get help face to face. I'm in the community. I'm in Fall River, New Bedford, Brockton. So call the customer service lines, MassHealth, Health Connected. They will also give you this information.
Yeah. Also, if you go to that website with the
And our website
it-
has a lot of information, a lot of resources. Yes.
yes, and if you go in and put your zip code in, you can see where the closest ones are, and you can call and make appointments or email them, that kind of thing. I know the First Health in Health First in Fall River. There's Pace in New Bedford. There are several around in this area where you can make an appointment and actually sit down with somebody like Carla.
Yep.
I think the health department in New Bedford as well, and some of the other health departments in the various cities have some help there as well. But you want to make sure you look for the help, and if you find it daunting, these people are very happy to help you get yourself the insurance that you need and deserve.
Yes.
Oh, other questions? Well, we may be working on our shortest workshop ever, and I thought this would be one of the longer ones, but that's okay. Hang on a second. I am going to launch the poll so that you can all take the poll. And you can do this while we're actually here. You can do it right on screen. It's anonymous. We don't get any information about who filled this out because you happen to be in the workshop. This is information that helps us to know if we're hitting the sweet spot, or if we're we need to be revising what we're doing. It also gives us a little bit of demographics, again, not personalized, but demographics, like, so we can say, we're helping people from this group or that group, this zip code or that zip code, that kind of thing, which funders really like, and we like our funders.
I do want to mention that after watching this webinar, or if you watch the recording again and after that you do have questions, or you attempt to do the application by yourself and you have questions, we do also host webinars with the Health Connector, and it's kind of the same format, and you have time for questions at the end. So if after this you decide, actually, wait, I do have a question, and you want to wait for another webinar, you can attend that webinar as well and ask your question there. And you can, like, if you don't want to wait that long, if you want to make sure you're getting that payment in by the 23rd to be covered on October 1st, go to your navigator. But we do have a lot of good YouTube videos, and we have live webinars as well where you can ask your questions.
And also, the slide deck that Thalia went through earlier, again, will be up on our website. It's actually there now. So if you go to our workshop website under the resources, you can actually get that. And it has a lot of active links. So if there's questions where you saw those blue highlights in her presentation that you couldn't click on, if you bring up the PDF, you will be able to click on them and actually get to those websites or those resources. So I would encourage you to do that, and I would encourage you to spread the information around, and tell your friends and family, pass this information along, and pass the workshop along. Somebody's asking where the recording will be found later. If you go to our website, practicebestpractice.com, it will be on the workshops page as soon as it's available. And we tell people that they're available through our Facebook. We post on our Facebook when it's available, and we send out an email blast when it's available. So if you want to know as soon as it's available, as soon as the video is up, then simply make sure that you're signed up as a follower on our Facebook, or better yet, as a subscriber, an email subscriber on our email list. And you will get that as soon as it goes up, because the day that I put it up is the day that I send those out. Any other questions? Well then, I guess we're gonna wrap it up. You get to go home and have supper early, you guys. All right. Well, final opportunity. All right, thank you all for coming. And again, if you have other questions, feel free to contact through us or contact through the MassHealth website, and get yourself the health, you and your kids, the health care that you need.
Thank you, everybody. Have a good night.
Thank you, everyone.
Thanks all.